In this session, we'll deal with the gross anatomy of urethra. Male urethra is a common tubular passage for the elimination of urine and semen. It extends from the internal urethral orifice at the apex of trigone of bladder to the external urethral orifice close to the tip of the glans penis. So, in the flaccid state of penis, the urethra describes an S-shaped double curve and is subdivided into four parts, namely the pre-prostatic part, the prostatic part, membranous part, and spongy part. So average length is around 18 to 20 centimeters and an average breadth is 6 millimeters. So if we see, the total length will be 18 to 20 centimeters, that is approximately 8 inches. The pre-prostatic part measures around 1.5 centimeters. Then prostatic part measures 3 centimeters. The membranous part has different length compared to anterior wall and posterior wall. Anterior wall is 2 centimeters and posterior wall is 1.25 centimeters. So in membranous part, anterior wall is longer than the posterior wall. The spongy part is approximately 15 centimeters and average breadth is 6 millimeters. The minimum breadth is seen at external orifice, that is 4 millimeter, whereas next to that the minimum breadth is observed in membranous part, which is around 5 millimeters, and the maximum breadth is observed in prostatic part, that is 8 millimeters. So you can observe here, this is the pre-prostatic part, this is the prostatic part, this is the membranous part, this is the spongy part, this is the navicular fossa in the terminal part of the spongy part of the urethra. This is the external urethral orifice and this will be the internal urethral orifice. So if you see the shape of the urethral lumen on cross section, it varies in different parts. So why? Because this irregular lumen induces a spiral twist in the urinary flow and prevents early separation of the droplets of urine. So that is why the urinary flow in males is projectile in character. Now if you observe the shape of the lumen on cross section, the pre-prostatic part is stellate, the prostatic part is crescentric with convexity in front, the membranous part is stellate or irregular, on the spongy part it varies at different places. So at the bulb of the penis it is trapezoid, floor being wider than the roof. At the body of the penis it is a transverse slit, at the base of the glans penis inverted T-shaped slit, and at the external orifice it is a sagittal slit. So this variation in the shape of the lumen makes the flow of urine projectile. Now description of the parts. So we start with the pre-prostatic part. So it's around 1.5 centimeters long, almost vertical, extends from bladder neck to the colliculus seminalis. So it is surrounded by a distinct circular collar of smooth muscle which is innervated only by the adrenergic sympathetic nerves. This pre-prostatic sphincter prevents reflux of semen into the bladder during ejaculation and controls the continence of urine even when the external sphincter is damaged. So in transurethral resection of prostate, the sphincter may be disrupted, producing retrograde ejaculation. Next, coming to the prostatic part. So again, it continues downwards from the pre-prostatic part. So actually, if you see the location within the prostate, it is at the junction of anterior 1/3 and posterior 2/3 of the gland. And prostatic urethra, as from the measurements, we can already know that prostatic urethra has the widest lumen and it is the most dilatable part. The length is around 3 centimeters and the maximum width is about 8 millimeters in the middle. On cross section, it presents a crescentric lumen with convexity directed in front. So when urethra is empty, anterior and posterior walls come in close contact. So coming to the features of the prostatic part of the urethra, especially on the posterior wall of the prostatic part of the urethra, you can observe here there is a median crust called as urethral crust. The middle of the urethral crust is having an elevation called colliculus seminalis or verumontanum, which presents opening of 3 structures. In the center, it is the prostatic utricle, which corresponds with the vagina in female. And here you can see these are the openings of the ejaculatory ducts. On either side, you can see these are the prostatic sinuses, which receives the ducts of the prostatic glands. If we go in detail, urethral crust, it is a median longitudinal mucous fold which gradually increases in height as it descends. The height reaches maximum of about 3 millimeters at the middle of the crust It fades away below by dividing into branches. The crust is produced by insertion of trigonal muscle of ureters. Folliculus semilalis, otherwise called verumontanum. It is a rounded elevation at the middle of the crust and presents three orifices: the prostatic utricle in the middle, which I have shown in the earlier diagram, and ejaculatory duct on each side of the utricle. Then the prostatic utricle, it's a mucous cul-de-sac, 6 mm long, extends upwards and backwards from the colliculus behind the median lobe of prostate. The utricle is surrounded by a fibromuscular coat and lined by mucous membrane, which is provided with numerous mucous glands. It is developed from united caudal ends of the two Mullerian ducts, otherwise called paramesonephric ducts, and corresponds with vagina of female, hence called as vaginus masculinus. The colliculus corresponds developmentally with the Mullerian eminence. Then each ejaculatory duct, which is about 2 centimeters long, is formed by union of vas deferens and seminal vesicles, passes posterolateral to the median lobe, and opens at the colliculus on each side of the prostatic utricle. The prostatic sinuses or mucous gutters on each side of the crust, as I have shown in the earlier diagram, receives the opening of ducts of the prostate gland. So if you observe, on each side of the prostatic urethra, behind and in front, all around, the prostatic urethra is surrounded by prostate gland. So if you observe in front, it is the isthmus of prostate. On either side, it will be the lateral lobe of prostate. And behind, in the upper part, it is the median lobe. And in the lower part, it is the posterior lobe, which is nothing but continuation of the two lateral lobes. Now coming to the membranous part, which is the second narrowest part of the urethra. It runs a slightly curved course downwards and forwards from the prostate to the upper surface of the bulb of the penis, about 6 mm in front of the posterior end of the bulb. You can see here. So this is the prostatic part, preprostatic, prostatic, the membranous part. So runs from the prostatic urethra to the bulb of the penis around 6 mm in front of the posterior end of the bulb of the penis. You can see the anterior wall is longer than the posterior wall. Membranous urethra pierces the perineal membrane about 2.5 centimeters behind the lower border of the symphysis pubis. The bulb of the penis comes in contact with the perineal membrane in the posterior part, but in front they are separated by a gap through which the urethra passes. So therefore, the anterior wall of the membranous urethra is more longer than the posterior wall. Anterior wall is about 2 centimeters, whereas posterior wall is about 1.25 centimeters. And on cross section, the lumen is striate or irregular. So on each side of the membranous urethra, vulvourethral glands are present along with its duct. In front, deep dorsal vein of penis, which enters the pelvic cavity between transverse perineal ligament and the arcade pubic ligament. So next, coming to the spongy part. So spongy part is a continuation of the membranous urethra. So in the beginning, within the bulb of the penis, it presents a dilatation called intravulvar fossa, and at the terminal part also it presents a dilatation called navicular fossa. And you can see one of the urethral lacunae is large at the base of the glans or at the beginning of the navicular fossa, that is called as lacuna magna, which will be guarded by valvulae of Guerin. And these glands, mucous glands which open into the urethra, are called as glands of Litter or urethral glands. So spongy part contained in the corpus spongiosum of the penis, 15 centimeters long, passes through bulb, body and glans penis, terminates as external urethral orifice. Intravulvar fossa is the dilatation in the bulb of the penis, and navicular fossa is the dilatation in the glans penis. And between these dilatations, the average caliber is around 6 mm. So intravulvar part is around 3 centimeters long, formed mainly by the floor sides, hence trapezoid and cross section, receives the ducts of bulbourethral glands. Terminal fossa is about 1.25 centimeters long, lined by Stratford squamous epithelium. Features in the spongy urethra. Urethral glands are Letter's glands. These are simple tubular mucous glands which open in the entire spongy part except the terminal fossa. Urethral lacunae. These are pit-like mucous recesses which project from the entire urethra except the terminal fossa. The mouth of the recesses are directed forwards to the external urethral orifice. You can see here. So the mouths are directed towards the external urethral orifice. So one lacunae known as the lacuna magna, you can see here. This is the lacuna magna, larger than the rest and situated on the dorsal wall of the commencement of terminal fossa or navicular fossa. So it is guarded by a mucous fold known as valvule of Garin. Sphincters, internal sphincter, otherwise called as sphincter vesicae, involuntary, surrounds the internal urethral orifice. Anatomically, the existence of internal sphincter is questionable because the detrusor muscle is arranged into a series of U-shaped loops. U-shaped loops, both in front as well as behind, and circular deposition of the muscle is not observed. Probably the contraction of trigeminal muscle of ureters pulls up a cushion of mucous membrane which closes the internal urethral orifice, particularly during ejaculation. The external sphincter is voluntary and derived from sphincter urethral muscle which surrounds the membranous urethra. So the following are the vessels which supply the male urethra, especially the inferior vesical artery, middle rectal artery, internal pudendal artery, and urethral branch of the artery to the bulb of the penis, which is ultimately the branch of internal pudendal artery. The veins corresponds to the arteries. Prostatic and membranous parts drain into internal and external iliac lymph nodes. Spongy part drains into deep inguinal lymph nodes. Sometimes it will also drain into external iliac lymph nodes. Most of the urethra is supplied by autonomic nerves and terminal part by somatic nerves. The sympathetic fibers are derived from the superior hypogastric plexus, where the preganglionic fibers comes from L1 and L2 segments. Parasympathetic fibers are derived from pelvic splanchnic nerves. The carrying preganglionic fibers comes from S2, S3, S4 segments. Somatic fibers are derived from the urethral branch of the pudendal nerves. Applied aspects. So already in earlier classes, like in the development of the urinary system, we have already discussed hypospadiasis, where the urethra opens on the undersurface of the penis, and depending on the location, it has been classified into several types. Like if you see glandular, it is below the glans penis. At the base of the glans penis, we call it as balanic type. Then penile, when it opens under the shaft of the penis. Then penis scrotal at the junction of the penis with the scrotum, and complete perineal, where it opens in the perineum. In epispadiasis, where the urethra opens on the dorsal aspect of the penis, it is always associated with the ectopia vesicae, which is nothing but anterior abdominal wall below the umbilicus is deficient, and the anterior wall of the urinary bladder is deficient, and directly the interior of the bladder is exposed to the surface. An extrusion of chloride line includes, along with the ectopia vesicae, there will be abnormal genitalia also. And rupture of urethra, either by instrumentation or by accidental fall on perineum. So usually this instrumentation, or we will be doing catheterization. We use Foley's catheter, which is passed through the urethra. So damage to the male urethra can occur when we are doing Foley's catheterization in emergency ward, or during ICU stay of the patient, where patient cannot pass urine on his own. So if we dilate the bulb of the Foley's catheter before its final position, then that will dilate within the any part of the urethra, and it will rupture the urethra. So traumatic rupture of the urethra below the perineal membrane, there will be extravasation of urine into the superficial perineal pouch, whereas traumatic rupture of urethra above the urogenital diaphragm produces extravasation of urine in the pelvic extraperitoneal space. So female urethra is around 4 centimeters long and 6 millimeter wide. It begins from the internal urethral orifice, passes downwards, embedded in anterior wall of the vagina, pierces perineal membrane, and opens in the vestibule as external at the external urethral orifice. So external orifice is situated in front of the vaginal opening, about 2.5 centimeters behind the glans clitoris. Then the glands which open into the female urethra are the urethral glands and paraurethral glands of Skene, which corresponds with the prostate in male, and greater vestibular glands, which corresponds with the bulbourethral glands in male. These greater vestibular glands open below the hymen into the vagina, whereas paraurethral glands will open just before the external urethral orifice. So urethral lacunae. So you can see here, this is the female urethra. You can see it is starting from the neck of the bladder and coming up to the external urethral orifice. You can see these are the urethral glands. You can see these are the paraurethral gland and its duct, which is opening just before the external urethral orifice. You can see the greater vestibular glands, which are opening into the vagina below the hymen. So exogenous infection is more common due to shortness of the urethra, and stress incontinence in multiparous women is due to increase of uretrovesical angle or increase in urethral axis. You can see here in this diagram. So this is a normal uretrovesical angle which is around 100 degrees, and you can see the urethral axis, it's around 30 degrees with the vertical. So when the urethral axis increases, that is more than 30 degrees, and the uretrovesical angle increases more than 100 degrees, then there will be incontinence. Thank you.